Welcome, everyone. It is a pleasure for me to welcome you to this session that is entirely dedicated to discussing the role of ethanol ablation for refractory arrhythmias. Ethanol, for those of you who are young, ethanol was one of the first technologies ever developed for the treatment of cardiac arrhythmias, specifically ventricular tachycardia in the setting of ischemic heart disease. It goes back to the late 1980s when Dr. Pedro Brugada in the Netherlands then reported a series of 3 cases where he treated successfully ventricular tachycardia in the setting of ischemic heart disease by injecting ethanol in the infarct-related artery. So the artery that was supplying blood supply to the VT substrate. The technology was then superseded appropriately by radiofrequency when the first data sets from reports of radiofrequency were showing very reliable success using that technology. So alcohol became relegated to a bailout approach for difficult to treat arrhythmias. In 2007, we started working on the idea that we could use alcohol to specifically treat Vaino-Marshall related arrhythmogenesis in atrial fibrillation. And we took that from the idea to the animal lab and then to first-in-man cases. And that culminated just very recently in the completion of a large randomized clinical trial that I will be discussing. In the process of working through the technique of delivering alcohol in the Vaino-Marshall, we refined the technique for also treating ventricular arrhythmias. And we accumulated a substantial experience in using the ventricular venous approach to treat ventricular tachycardias and PVCs. In this session, we're going to have 4 talks that will be devoted to discussing all aspects of ethanol use for refractory arrhythmias. I will start first with a historical discussion and mechanistic discussion of the mechanistic underpinnings of the use of Vaino-Marshall ethanol for atrial fibrillation, and all the data that we accumulated for the treatment of macro-reentrant atrial arrhythmias, specifically perimitral flutter with Vaino-Marshall ethanol. Then Dr. Kaoru Okishige from Yokohama, Japan will follow me, and he will be discussing his experience using the combination of ethanol in the Vaino-Marshall with cryoablation for atrial fibrillation, which is a very unique experience that he has accumulated a large data set. And this will be followed by Dr. Nicolas Derval from Bordeaux, France, who will be discussing the Bordeaux experience using Vaino-Marshall ethanol infusion in persistent atrial fibrillation. Finally, I will conclude with a talk about the role of ventricular venous ethanol for ablation refractory ventricular arrhythmias. With that, I will stop the introduction. I hope you like it. And as much as we like it, we like the preparation of the whole session. Thank you very much.